Hi, my name is Jennifer Fulton and this is my health assessment video. We would start our health assessment by getting the patient to empty their bladder, take a full set of vital signs including height and weight, and then we tested his vision, his near vision and distance vision with the Snellen and Rosenbaum charts, and then I asked him to get into a gown. So the first thing that we would assess would be the head and the face. I would start by inspecting the skin on the face and the skull and the scalp, looking for any lesions, any nodules, any abnormalities. I'm looking at the symmetry of his eyes and his ears and his mouth and nose. Everything looks good. Then I would go on to palpate the skull and the scalp, assessing for any nodules, any abnormalities, any tenderness. Any tenderness there?
No.
Then I'll move on to palpate the facial bones, assessing for any tenderness. Everything feel okay?
Yes.
And then I want to assess his temporomandibular joint for any TMJ or any issues. Can you open your mouth for me? And then close. No clicking there, so everything is good. Then I'd move on to palpate the sinuses. Anything tender there?
No.
The frontal. And then I'll palpate the maxillary sinuses. Anything tender there?
No. Very
good. Next, I'd like to move on to the neuro exam and assess the cranial nerves. Cranial nerve 1 would be assessing the sense of smell, which is not required for this video, so we won't do that. Cranial nerve 2 has already been assessed with vision charts through the distant and near vision Snellen and Rosenbaum charts for use. And then cranial nerves 3, 4, and 6 will be assessed next when we do the eye exam. And then so we'll move on to cranial nerve 5. Can you clench your jaw for me? I want to feel that muscle strength there. Very good. You could also test the corneal reflex, but we're not going to do that. And then squeeze your eyes real tight for me. Very good. Cranial nerve 7, can you smile? And then frown. Puff your cheeks out. And then wrinkle your forehead for me. Good. And then cranial nerve 8 will be tested when I test his ears, which would test his hearing. 9 and 10. I'm going to test your gag reflex. So open for me. Okay, that's intact. And then can you say ah? Stick your tongue out and say ah. Ah. Very good. I'm noticing the movement of the palate and the uvula when he says ah, so that nerve is intact. For 10, I'd like to get you to shrug your shoulders for me. And then shrug them against resistance. Very good. Can you turn your head side to side? And then against resistance? Sorry. And again. Very good. And then for cranial nerve 12, can you stick your tongue out for me? Up towards your nose. Good. Down towards your chin. Side to side. Very good. Next, I would like to assess his sensation for light and soft, or sharp and soft touch. So if you can close your eyes for me, I'm going to get you to tell me if it's soft or sharp. We'll start with the forehead.
Sharp. Soft.
Cheeks.
Sharp. Soft.
Chin.
Soft. Soft.
We'll move on to the arms.
Sharp. Sharp. Soft. 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 Sharp.
Legs.
Sharp. 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 Soft.
Very good. All right. Next, we'll move on to the eye assessment. I would start by just inspecting the eyes themselves, inspecting whether they're symmetrical, where their placement is on his face. I want to look at the eyelashes, make sure there's equal distribution, make sure that they're growing out and up, make sure he doesn't have any turning in of his eyelids, any turning up of his eyelids. I want to look at his sclera, make sure it's good and white and clear. I'm not noticing any signs and symptoms of jaundice, any redness. And then I want to take a look at his conjunctiva. So can you look up for me? Again, look up. Very good. Everything looks nice and clear. No redness, no drainage or exudate. Then I want to palpate the lacrimal apparatus. Everything looks good there. Can you close your eyes for me? Palpate the eyelids lightly. I don't feel any nodules. Is there any tenderness there?
No.
Okay. Very good. Next, I will move on to where I will assess cranial nerves 3, 4, and 6. So first, we will assess his pupillary response. So if you'll just look straight at my nose, I'm going to shine a light into your eyes. I'm checking for direct pupillary response, okay? And then the consensual pupil. Very good. Same over here. Direct, Very good. And consensual. Very good. Then I want to test the 6 cardinal fields of gaze and his extraocular movements, which also would be part of those cranial nerves. So if you can keep your head still and just follow this pen with your eyes. Very good. No nystagmus, no abnormalities in the movement of his eyes. So everything looked good there. Next, I would do the cover-uncover test to assess for any strabismus or any weakness in his eye muscles. So if you can focus on an object over there at the wall, I want you to cover your right eye. And now uncover. Now cover your left eye. Now uncover. Perfect. I didn't notice any abnormalities in the movement of his eyes. They were both focusing on the object well. So next I want to move on to the ears. I'll start again by just inspecting the ears, looking at the skin, the color, the texture, the placement. They both look equally placed on his head, equal and normal size. I don't notice any exudate, any excess cerumen in the external canal. And then I'll move on to palpating the auricles. Any tenderness there?
No.
I'd be checking for nodules, any abnormalities, and everything looks good. Next, I would assess cranial nerve 8, like we talked about, which is along with his hearing. So I'm going to do the whisper test. If you can cover one ear and repeat the word whispered.
Salmon.
Okay, cover the other ear.
Baseball.
Perfect. Very good. Then I would also assess his hearing with the Weber and Renna test. If you can tell me if you hear this better in one ear or the other, or hear it equally in both.
Okay. Both.
Okay. Now I'm going to test his bone and air conduction. So if you can tell me when you stop hearing this, please.
Okay.
I'll do it on this side. Placing this on the mastoid bone.
Now. No.
Very good. So air conduction should be about twice as long as bone conduction, and he passed that test perfectly. Next, I would like to look into the ear canal itself and assess the tympanic membrane. Turn my light on. I can see the tympanic membrane. There's no abnormalities or no redness. His membrane is nice pearly gray color. There's no bulging. There's not excess cerumen. All of the landmarks are visible. I would perform the same thing on this side as well. So then we'll move on to assessing the nose. Once again, we'll just inspect the external characteristics as well. It's midline on his face. The septum appears midline. There's no obvious deviation to one side or the other. There's no drainage, no lesions, no crust that we can see. Then I want to assess the patency, the patency of each nostril. So can you occlude one nostril and breathe in and out for me? All right, and occlude the other. Very good. Then I would want to assess the inside of his nose. So I'm going to change out my little end piece. You can tilt your head back for me. I'm just looking at the nasal mucosa, looking at the turbinates. The septum looks nice and midline. I don't see any deviations. I don't see excess swelling or redness of the turbinates. No polyps are noted. Equal hair distribution throughout both. So everything looks good there. Then I would move on to the mouth. Start by assessing just the external characteristics. His mouth is nice and pink. It's moist. There's no lesions. There's no cracking, no fissures noted. I'd want to assess his mouth, his buccal mucosa, his gums, hard and soft palate. So if you can open your mouth for me. Just looking in, his gums look nice and pink. There's no bleeding. Take my tongue depressor, see more. Open up for me. Assessing the hard and soft palate. Everything looks nice and pink and moist. Can you lift your tongue to the roof of your mouth? The frenulum looks good in midline. I see good blood vessels on the bottom of his tongue. I'm not sensing any malodors out of the mouth. I want to look at his teeth. Say ah, thank you. Looks like all of his teeth are here and in good condition. Don't see any obvious cavities or abscesses. They're nice and white. I want to check out the posterior pharynx. So if you can open your mouth, stick your tongue out for me. Say ah. I see where he used to have tonsils, absence of tonsils. Posterior pharynx looks nice and pink and moist as well. I'd also want to inspect the tongue, looking for any lesions, any abnormalities. If I had gloves on, I would pull the tongue from side to side. So can you stick your tongue out for me? Looks good. I don't see any lesions, no furry, white abnormalities of his tongue. Can you move to one side? Perfect. Everything looks good there. Other side? Everything looks good there. Very good. And then we already assessed his gag reflex and his movement of the uvula with the cranial nerves. So now I'm going to move on to the neck assessment. I'll start again by just assessing the external. And everything looks good and symmetrical. He has equal muscle mass of his neck. His trachea looks nice in midline. I would also like to check for jugular venous distension. So if you can look over your shoulder for me. Don't notice any distension. I'm going to press on your stomach. Nope, everything looks good there. I also would want to assess for like active and passive range of motion. So can you move your head side to side, touching each ear towards the shoulder, front and back? Very good. Now let's do that against resistance to your shoulder. Good. To your shoulder. Good. Forward. Backward. Shrug your shoulders for me. And now let's do it against resistance. Excuse me. Then I'd like to palpate the carotid arteries separately, one at a time. Very good. I'd also like to palpate the thyroid, assessing for any nodules, any tenderness, any enlargement. So, locate it here. Can you swallow for me? Very good. Everything feels nice and smooth, no nodules noted. I'd like to palpate along the trachea, make sure it's midline, not deviated one side or the other. I don't feel any nodules. Everything feels straight in midline and looks great. Then I'd also like to palpate the lymph nodes to see if there's any enlargement or tenderness there. So we'll do pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, have our anterior and posterior cervical chain. Got your deep cervical, your supraclavicular, and then if you'll lift your arms for me, please, palpate these axillary nodes. All right, everything looks really good there. Then I'd like to listen to his carotid arteries for any bruits, and also listen to his thyroid for any bruits there as well, using the bell of my stethoscope. Can you take a deep breath in and hold it? And breathe. Hold it. Good, and breathe. Then I'll listen to over the thyroid. Okay, and I don't hear anything there. Everything sounds good. Then I'd like to move on to the upper extremities. So I just start by assessing the extremities themselves, looking for any abnormalities in the skin, any discoloration, any abnormal moles, any lesions. I want to check for equal muscle mass. Everything looks symmetrical here. Palpate the joints for any tenderness. Can you bend your elbows for me? In and out. Don't feel any crepitus there. Muscle mass feels equal. I'm going to check the hands for skin color. Checking the nail beds. They're nice and pink. I don't see any clubbing on the nails. They're nice and round. Cap refill is good and brisk, less than 3 seconds. Then I want to check his pulses for symmetry. Brachial pulses are nice and strong, equally strong. Radial pulses are nice and equally strong as well. Then I'm going to move on to the back and the posterior chest. So if you'll turn around for me. I'm going to inspect the back itself. I'm going to inspect for symmetry of the thoracic cavity, looking for any lesions, nodules, any issues with the scan itself. Then I'm going to palpate for tenderness. Any tenderness?
No.
I'm going to palpate for tenderness along the costovertebral angle. Any tenderness here?
No.
What about now?
No. No tenderness.
Okay, everything looks good there. I would move on to the lung assessment. We'll do the posterior lung assessment. I want to be looking for rise and fall of the chest with respirations. Want to see if there's any, extra, any accessory muscle use, his positioning, if he's having to lean over to get a good breath. Then I'd like to palpate for the expansion of his chest. I'll put my hands at about the 10th rib. Can you take a deep breath in and out? Very good. So what I'm looking for is equal rise, or equal expansion of my hand so that both sides are expanding at the same rate, and they were. Then I'd like to assess for tactile firmitis. So when I put my hands on your back, if you can say the words 99.
99, 99, 99, 99, 99.
Very good. There was equal resonance felt throughout the whole posterior chest cavity. Then I would like to percuss the posterior and lateral aspects of the lungs, assessing for any dullness, any possible atelectasis, things like that. And we'll go side to side systematically. Everything sounds good there. We'll do the lateral chest. And if he didn't already have his arms up, we would ask him to do so. Perfect. Everything sounds good there. Next, I'd like to percuss for diaphragmatic excursion. So I'll get him to take a good deep breath in and hold it. Okay, blow out. I would mark that spot on his back with a pin. And then I want you to take a good deep breath in, blow out, and hold it. Perfect. So that's about 3 to 5 centimeters, which would be within the normal range. I would do this on the right side as well, and the right side might be a little higher than the left due to the position of the liver. Next, I'd like to listen and auscultate to the posterior lung fields and the lateral lung fields. Deep breath in and out. Everything sounds good there. I'll do the lateral lung fields now. Okay, everything sounds good there. Now I'll have you turn around again, please. And I'll auscultate the anterior chest wall. Thank you.
Mm-hmm.
Deep breath in and out. Perfect. Now I'd like to move on to the anterior chest assessment and the heart and cardiac assessment. So I would inspect the anterior chest, looking for any abnormalities in the skin, any nodules. I want to be looking for respiratory effort, equal rise and fall of the chest, no accessory muscle use, no increased work of breathing or labored breathing, and all of that looks good. I also want to be looking at the chest for any obvious heaves or pulsations or anything like that. You could assess that while the patient's laying flat if you had any suspicion of that, and use a pen light. Everything looks good there. I'd want to move on to palpating. I want to palpate the chest wall itself for any tenderness, any abnormalities. Is anything tender throughout here? Okay. Everything looks good. I want to palpate the apex of the heart. You could also find the apical impulse while you're here as well, which is usually at the fifth intercostal space, mid-clavicular line. Sometimes this is not felt due to the size of the patient or increased body habitus. I'd also want to palpate the left sternal border and the base. Then I'd also like to assess for tactile, or do tactile firmitis on the anterior portion of the chest. So as we mentioned earlier, when I put my hands on your chest, say the words 99, please.
99, 99, 99, 99, 99, 99.
Perfect, thank you. You can also percuss for the borders of the heart. It is sometimes difficult, not necessarily reliable for determining an enlarged heart, but we can do that here. The next thing we would want to do would be auscultate the heart sounds. So aortic, pulmonic, Erg's point, mitral, and tricuspid, or excuse me, tricuspid and mitral. Alright, that concludes the anterior chest and cardiac portion. Now if I can have you lay on your back, head facing that way, feet facing this way. I'm going to move on to the abdominal assessment. I'd want to start by first assessing just the abdomen itself, external characteristics. I want to look at the contouring of the abdomen itself. I could use a pen light to look for any abnormal pulsations, any abnormalities in his anatomy. Everything looks really good there. Next, I'd like to move on to listening to bowel tones, and I'll also listen at the aorta. Or, excuse me, over the different arteries, bowel tones and different arteries. I'll listen in all four quadrants. And I'll turn over the bell of my stethoscope and listen over the aortic artery. Listening for any bruits, any abnormalities over the renal arteries. Iliac arteries. and the femoral arteries. Next, I'd like to percuss the abdomen for tone. I'll also percuss for liver and spleen borders. I'll start for the liver itself. Okay, seems normal in size. And then if you can roll over on your right side for me, I'd like to percuss for the spleen borders. Arm up, please. Thank you. Okay, thank you. You can roll back over onto your back. I want to assess for the aortic pulse. Okay, and then next I'll move on to light and deep palpation. Start with light palpation, just assessing for any tenderness, any masses or abnormalities. Is there any tenderness there?
No.
Okay. Then we'll move on to deep palpation, assessing for organomegaly, any masses, palpations, any tenderness too. Any tenderness there?
No.
Okay. Now I'm going to move on to palpating the liver and spleen and the kidneys. So I'll start with the liver. Can you take a deep breath in for me? There we go. Blow out. Liver feels nice and smooth, doesn't feel enlarged, don't feel any nodules. Then we're going to assess for the spleen. Deep breath in. Blow out. Do not feel it, and the spleen is not usually palpable. It would be abnormal if you were to palpate an enlarged spleen. Next, I want to palpate the left and right kidney. So right kidney. Okay. And left kidney. Okay, everything feels good, nice and smooth. I next want to assess his abdominal muscles. So if you can lift your head up off the bed for me. See, he's got good, equal, symmetrical abdominal muscles. I don't see any herniations, any protrusions. Thank you. You can lift your head, lower your head back down. Next, I'll move on to the feet and legs and musculoskeletal system. So if you'll come up for me. Thank you. We'll inspect the skin and the hair. There's equal hair distribution on both legs. No obvious lesions, anything like that. Muscles look symmetrical, equal shape and size. I'm going to palpate his legs for temperature, palpate for any edema. I don't see any edema. I want to palpate his popliteal pulses behind the knees. Then I want to palpate his posterior tibialis pulses behind the ankles. Very good. And then palpate his dorsalis pedis pulses on the top of his feet. They're all equally strong. He has good cap refill in his toes. His nail beds are nice and pink. Next, I'm going to move on to the musculoskeletal exam. I'm going to test his reflexes. So I'll start with the brachial reflexes. Put your arms down for me. Good. Let's do this one. Very good. We'll do the knee reflexes. Very good. Good. And then we'll go down here near the ankles to the Achilles tendon reflexes. Good. Very good. Next, I want to assess for strength. So if you can hold your arms out for me. Press down. Good. Palms up. Press up. Good. Bring your arms into yourself like this. Don't let me pull it. Very good. Fingers out. Don't let me push them in. Very good. Wrist up. Don't let me push them down or back. Very good. Shoulders out. Don't let me push them down. Very good. Bring your leg out for me. Pull down, back in. Very good. Now push out. Good. This side. Pull down. Good. Push out. Good. Press down on my hands with your feet. Good. Pull up towards your nose. Good. Everything looks equally strong. Now I want to assess the cervical and lumbar spine. So if you'll stand up for me and turn around. Just looking for symmetry, palpating the cervical spine, palpating the lumbar spine. Is there any tenderness there?
No.
Everything looks nice and good and straight. Can you lean over for me and touch your toes? Just want to assess the spine here. I don't see any curvature of the spine, any scoliosis or lordosis. Everything looks nice and midline. All right, thank you. So that concludes my physical assessment. Thanks so much.